the PWS CLIC is the Clinical Investigation Collaborative, and the mission's to improve the quality of clinical research and medical care for people with Prader-Willi syndrome across the lifespan through collaborative investigation and research to support evidence-based care. So this group started 2 years ago. We currently have 25 US sites and 3 Canadian sites in the group. We are voting on a new site this week, so we're always, gathering additional sites and additional interested clinicians. So how is the CLIC improving standards of care? So you might have heard Parisa talk about it a little bit in the previous session, but one of the ways the CLIC's improving standards of care is by improving the quality of clinical research. And so the way that we're doing that is one of the main initiatives is to work with this company called StudyTracks, and it's an electronic data capture application that runs clinical trials, surveys, and patient registries. So the way that we're using it is creating a shared central repository for, I think the most importantly, de-identified PWS patient clinical data. So that is lab results, that is clinical assessments. So we're hoping that once this gets up and running, we're working out the kinks with a couple of pilot sites right now, but what we're hoping is that every single CLIC site can put in de-identified patient data. They can put in the labs that they're collecting, they can put in the clinical assessments, they can put in the anthropometrics, the height, weight, BMI, HbA1c data, like all of this stuff, so that we can pool the data and answer clinical questions that we couldn't just looking at like an individual clinic site. And the really cool thing that we're doing also is the ability to link this clinician-entered data with data that you all have put in so tirelessly in the global PWS registry. So what's really important this way is that we can get the doctor perspective and the family perspective on different clinical issues. We can see, do those align? Are they different? In what ways? So I think we're going to be able to answer a lot of clinical questions using this really rich resource. As I mentioned, it really allows these PWS experts to pool patient data and answer questions they wouldn't be able to on their own. So we're really excited about this initiative. We think it's going to be a really powerful tool. So the goal with this is to use this shared database to ask clinical questions with the goal of optimizing clinical care in PWS. And Parisa is actually the first site to start entering data in this shared repository. So we hope to start answering some of these clinical questions soon. And then a separate project that I wanted to mention, you might have seen it if you are in the Global PWS Registry, is this feeding tube survey. So Dr. Sandy Roy at Cook Children's in Texas and Dr. Jessica Dewis at Children's Hospital Colorado were collaborating because they're both members of the CLIC, and so they came up with this feeding tube use and complications in Prader-Willi syndrome project. So they wanted to know, how often are feeding tubes getting placed? What's the primary reason for tube placement? What are the common complications, and are they differing by tube type? And nobody had asked this question in a standardized way before. So we thought, why not leverage the CLIC to answer this question? So excitingly, they just submitted this manuscript for review for publication last week. So hopefully we'll be able to get the full results soon, but they allowed me to give you some initial preliminary results from this project. So over about 350 people in the Global PWS Registry answered this survey and gave data, so it's a very large sample. We're seeing that of the people that answered this survey, 70% only had an NG tube, 25% had an NG tube and a G tube, and about 5% had a G tube only. When they looked at the reasons for feeding tube use in both types, so in both NG and G tubes, feeding difficulties or poor weight gain were really the most common reason for the tubes. But interestingly, another reason was aspiration or breathing difficulties, and in here they saw about 20% of G-tube placement was due to this aspiration or breathing difficulties, but only 5% of NG tubes were for this reason. So G-tubes were getting placed a lot more if the child had aspiration or breathing difficulties. Looking at when they were removed, NG tubes were normally removed by the time the child was 6 months old, but as you can see, the G tubes, it normally took until about 2 years old to get removed. So those G tubes are getting removed at a later time point than the NG tubes. They did find the complication rate was higher from G tube placement than NG tube placement, but positively from caregivers. Both NG tubes and G tubes had positive effects on quality of life. So that was exciting to see. It seems like feeding difficulties were managed well by just the NG tube, and that it's something as we're working towards, well, what's going to come out of this, any sort of care guidelines. I think it's really important to consider that the G-tube placement, it is a surgery, so it does come with surgery-related risks, and this decision should really be considered carefully. So some of the overarching themes too is that one, they would really like to thank all the families of the younger and older kids contributed to the study through the Global PWS Registry. They could not have done the study without your work in filling out the survey, so they want to give a big thank you to all of you. And I think this data is really important to understand. We've never looked at before, what are the short-term and long-term complications of feeding tubes? So there were some people in here that the caregivers were talking about their kids are 20 now, and so they were trying to think back 20 years when their kid had an NG tube or a G tube, and what were the complications. And so looking really at both the short and the long-term complications of these feeding tubes, I think is really important. I think this data is really going to help these CLIC members understand what's happening around the country, what are the current practices of feeding tube placements, and are those right? Do we need to be changing the standard practices? In our CLIC meeting that we had on Tuesday, a lot of people were saying it was really the neonatologists in the NICU that were pushing some of these different types of tubes. So this research, especially when it gets published, I think is going to be really helpful for the PWS clinicians to go back to the neonatologists and say, maybe a G tube is not necessary every single % of the time. Maybe we can get away with just doing an NG tube. So these are the types of questions that I think are going to be really important to be answered through the CLIC. So we're really excited to see this type of research start getting completed. And like I said, they just put in this manuscript for publication, so the full study results will be out in the coming months. I'm sure FPWR will probably do a blog or some sort of social media push once it gets published, so to be on the lookout for the updates and more details of the study as they come out. So I just wanted to, get the PWS CLIC is in its infancy, but we're already starting to get some really great research, really great clinical research out of it. So just wanted to highlight a couple of those things. So with that, we have a couple of minutes for questions if anybody has any. Thanks. Oh, thank you.
When they come out and they publish these things, will there be any central location to find these, or is it just kind of how you have to search for them? Because if you find a doctor who doesn't want to listen to you and you want to guide them in the direction of where to find these things, will there be a central location to find that, or do they just kind of have to search and try to find it on their own?
Yeah, that's a great question. So right now, this manuscript is going in for publication to a medical journal. So that's where it would live, once it gets published. But that's I think one of the things that FPWR can do is to push out, once it comes out, we can write a blog on it, make sure people are aware on social media so that you can go and find the link to the paper, because sometimes they are very buried. You go on PubMed and do very detailed link searching. So that is something that we hope to be able to help in some of these ways that the medical literature is what's standardized and approved, and doctors know about it and they listen to that sort of data, but it can be hard to find. So that's where we hope to come in, is to sort of push it out to you all in different avenues so that you have that information and you don't have to waste time searching for it.
You can probably direct us to a website where we can see the list of the 25 sites?
Yes, exactly. It is fpwr.org/PWS-CLIC. So that is where you can see the mission, the vision, current projects that are working on, and then a list of all of the sites and the institutions, the doctors, and their specialty.